Welcome to this explainer. Look, we've all messed around with AI chatbots for quick health questions, right? Well, today we're examining a massive leap forward. Google DeepMind's new AI Co-Clinician. We're talking about moving way past simple text search and stepping right into the era of the real-time multimodal medical assistant. It's not just about pulling up facts anymore. It's about active simulated patient consultations.
So, what if you had 24/7 access to a world-class doctor? Just think about that for a second. Imagine waking up at 3 a.m., something feels totally off, and instead of spiraling into a late-night internet panic, because we've all been there, you can instantly get guidance to figure out if it's serious or not. That ultimate convenience is the absolute dream. But to understand how Google's trying to make that a reality, we really need to face the stark reality of where our current system is at.
Which brings us to Section 1, the global healthcare crisis.
10 million. You know, it's honestly hard to even wrap your head around a number that big. But healthcare systems globally are already stretched incredibly thin. And the World Health Organization predicts a global shortage of over 10 million healthcare workers by the year 2030. That's 10 million missing doctors, nurses, and specialists in just a few short years. It's a staggering shortfall.
Now, Google's approach to this massive problem embraces a core philosophy. Medicine has always been a team sport. Their goal here isn't to build a robot that replaces your doctor. No way. The idea is to just add more teammates to the field. They want to extend the reach of the clinicians we do have, making sure the human doctor ultimately keeps all the judgment and control.
All right, Section 2, enter the AI Co-Clinician.
Google actually calls this new setup Triadic Care. Basically, it's a healthcare model where AI agents actively participate alongside both the doctor and the patient. It's a three-way street. And this is a completely crucial paradigm shift because it reassures everyone that the doctor isn't being pushed out of the room. The AI is literally just sitting there with them, acting like a super capable assistant to catch things that might otherwise slip through the cracks.
Moving right along to Section 3, passing the ultimate test.
Okay, let's look at the hard data. Google rigorously evaluated this system using 98 highly realistic primary care scenarios. And they weren't just checking to see if it sounded smart. They were hunting for two very specific, very dangerous mistakes. First, errors of commission. That's when the AI confidently spouts incorrect medical info. And second, errors of omission, which is when it fails to bring up critical, potentially life-saving details. They had to be absolutely sure the outputs were totally factual and deeply grounded.
And the results? Honestly staggering. In 97 out of those 98 test cases, the system produced exactly 0 critical errors. Literally just 1 critical error across 98 realistic scenarios. Because of this insane level of accuracy, when they brought in human physicians for blind testing, those doctors actually preferred the AI Co-Clinician over the standard evidence tools they use every single day. It's an instant, game-changing improvement.
But wait, they didn't stop there. They threw it at the open FDA benchmark for complex medication reasoning. Now, this test is brutal. It focuses on open-ended, real-world situations. There are no multiple-choice answers to guess from. Real primary care docs actually scored relatively modestly on these closed-book tests, but the AI Co-Clinician, it outperformed both human doctors and other frontier AI systems. Let that sink in. It is outperforming human clinicians on complex, open-ended medical reasoning.
So, let's look at Section 4, AI that sees and hears.
In any real clinic, doctors rely heavily on what they see and hear, right? Well, by leveraging Gemini and Project Astra, this AI is fully multimodal. It monitors breathing patterns, assesses skin appearance, analyzes body movement, and even evaluates tone of voice. During testing, the AI literally watched a patient using an inhaler on video, noticed they were doing it wrong, and verbally corrected their technique. It even guided a patient's shoulder movements through a webcam to help spot a rotator cuff injury.
To really ground this high-tech concept, let's look at a simulated case study. Google had researchers role-play as telemedicine patients. In one specific scenario, a researcher acted like a patient suffering from acute pancreatitis, complaining of severe abdominal pain and not being able to keep any water down.
The absolute coolest part is getting to see the AI's real-time reasoning trace as it responds. It visually observes the patient's discomfort. It processes the audio about the water, and then it asks, does the pain radiate to your back? Any doctor will tell you, with those exact symptoms, their brain is instantly screaming, does it radiate to the back? The AI perfectly, intuitively mimicked a human doctor's thought process.
And then it gets even more fascinating. The AI asked the patient to do a brief, guided physical exam on themselves. It said, press on your belly button. The The patient goes, "No, that doesn't hurt." The AI absorbs that baseline, adjusts, and then asks them to press just above the belly button, the epigastric region. The patient reacts with severe pain. The AI actually used a physical exam best practice. Always test a non-painful area first before probing the exact spot that hurts. It reacted to the live video perfectly. How wild is that?
Which naturally leads us to Section 5, Guardrails for Medical AI. Look, when lives are quite literally on the line, AI hallucinations are a hard no. That's why Google built this dual-agent architecture. It's basically a genius safety net where two AIs work together. Agent 1 is the front-facing assistant, handling the ongoing conversation and the live patient interaction. Meanwhile, Agent 2 is running in the background, continuously monitoring the whole thing to make sure it stays within safe clinical boundaries. It's literally one AI babysitting another AI, ensuring everything prioritizes clinical-grade evidence.
And this isn't just some small lab experiment anymore. Now, Google is super clear that this is still firmly in the research phase. It's not out there diagnosing real diseases in the wild just yet, but they're already building global collaborations to test safety and efficacy. We're talking major partnerships already underway in the US, India, Australia, New Zealand, Singapore, and the UAE.
The vision for the next decade is incredibly profound. A personal AI assistant for every single doctor and a second doctor for every patient. Just imagine a complex case where multiple specialized AI agents are working in parallel. One's looking at your scans, another's tracking your live symptoms, and a third is cross-checking your meds to help build a flawless treatment plan. With these models getting better exponentially, this kind of transformation really feels inevitable.
Which brings us to the ultimate question to wrap up this explainer. This tech is moving at lightning speed. That global doctor shortage we talked about demands a solution, and the perks of instant expert guidance are undeniable. But at the end of the day, healthcare is deeply, deeply personal. So, considering the reasoning skills, the multimodal vision, and those dual-agent safety nets, would you trust an AI co-clinician to help manage your healthcare? Honestly, it's a question we're all going to have to answer for ourselves probably a lot sooner than we think.